Hello, my dear students. I'm Dr. Vaishaly Bharambe. I've been teaching anatomy for more than 25 years and I love it. Today, my dear students, I'm going to talk about a topic which is very close to my heart, palatine tonsil. I love it. Fortunately, students also like this topic. However, for some reason, you're unable to score in it. So today, I'm going to tell you how to remember it, how to score it, and just score in it. And just remember that all this in the form of notes is available on my website. So you can go and access it there later so that you have the right to study these notes as well. Okay. So let's begin. Palatine tonsil. So how this is just, the gist of what we're going to do. I want you to possibly take a screenshot of this next time you study. That's how I study. Okay. Next time you study, especially for your exams, you just go through these headings. You don't have to see the whole video again, right? Not that I would like it. Of course, I'll get viewership. But my suggestion is when you're studying, okay, at one point, you need to revise on your own. You don't have to keep on studying every day the same thing again and again. I hope you understand what I'm saying. So screenshot, this is why I've kept this here. Let's begin by introducing to ourselves what is the palatine tonsil. Palatine tonsil. Tonsil is a collection of lymphoid tissue. Palatine, that means it's somewhere close to the palate. So it's a mass of lymphoid tissue in the oral cavity. It's part of the Waldeyer's ring. What does that mean? What are the structures that form the Waldeyer's ring? The lingual tonsil, the palatine tonsils, the tubal tonsils, and the pharyngeal tonsils together form a ring around your nasal and oral opening in the pharynx. This ring found in the pharynx is called as the Waldeyer's ring. Okay. Now, what is the shape of this structure? It's about almond shaped. Size, it's seen that it's larger in children and much diminished in size as you grow older. Where is it? Let me tell you point blank that there are times when you're studying medicine when you need to not only smile at yourself in the mirror, but also do a big ah and look at the interior of oral cavity in the mirror. It's fine. So many times we look in the mirror and we smile. I'm looking good. Nice. Okay. Try this. Do a big ah. Look at the posterior part of your oral cavity. You will find the uvula in the middle. And then behind, you will find from the two sides the tonsils coming in. That space in which you find your tonsil is called as the tonsillar sinus. Right? So with this, we come to the question, what is tonsillar sinus? Take a look. Now, this is a sagittal section through the head neck region. In front, the tonsillar sinus is bound by a fold called palatoglossal fold, from palate to the tongue, palatoglossal fold. Posteriorly, palatopharyngeal fold, from palate to the pharynx. Superiorly bound by the soft palate, inferiorly bound by the dorsum of the tongue. This space bound by these structures is called as the tonsillar sinus and it houses your palatine tonsil. Right. So the palatine tonsil itself has the following parts. I want you to think of your wrist or of your hand as the palatine tonsil. So it has a medial surface and a lateral surface. It has an anterior border and a posterior border. It has got an upper end and a lower end. Have you got it? Sometimes it's nice to have something to look at. So use your hand as a palatine tonsil and the parts are there for you. So let's talk about anterior border, posterior border, upper end, lower end, okay, by drawing a sagittal section. As you draw this diagram, you will find yourself knowing these basics. Very easy. What is the anterior border? Where is the posterior border? Where is the upper end? Where is the lower end? Let's begin a diagram. Right. So now, I want you to draw the upper lip, draw the lower lip. You can draw the mandible a little bit. I want you to draw the tongue as I am showing you here. Above the upper lip now, draw your hard palate. Draw your soft palate. Draw the nose also, just to orient yourself, draw the nose as well. Okay. Now, from the soft palate, a fold descends downwards. By now, you should be able to tell me what is the fold called? Palatoglossal fold, containing the palatoglossus muscle. It covers the anterior border of the tonsil. Another fold posteriorly, palatopharyngeal fold, containing palatopharyngeus muscle, covering posterior border of the tonsil. So you know anterior border, you know posterior border. The upper pole abuts the soft palate. The lower pole, you should be able to tell me, abuts the dorsum of the tongue. So anterior border, posterior border, upper pole, soft palate, lower pole, dorsum of the tongue. You've got 4 presenting parts of tonsil in place already. Right, students. So you understood these parts of the palatine tonsil. Next, we need to understand its medial surface and its lateral surface. Okay. So the medial surface, it looks like, has tonsillar pits on it, tonsillar crypts on it, and a deep crypt which is called intratonsillar cleft. What is all this? Okay. You must be wondering. Similarly, the lateral surface again shows a lot of structures given here. How am I going to remember all this? Right? So again, I'll tell you the best way to do this is to draw a coronal section through the tonsil. So just imagine that you're taking a coronal section through the head neck region and begin a diagram with me. You'll be surprised at how well you remember the palatine tonsil at the end of this diagram. Right. So now here you're seeing the medial surface first, which is showing you a lot of tiny little pits. The bottom of the pit is called as a crypt. You're also seeing a couple of sometimes deep cleft. This deep cleft is called as the tonsillar cleft, which is related to the embryological development. Maybe you will be taught that sometime. Again, draw the same tonsil on the opposite side. The medial surface showing you tonsillar pit, tonsillar cleft, and the tonsillar crypt. What are the 3 features? Pit, cleft, crypt. 3 of them. Let's now go on to rest of the anatomy around the tonsil. Okay. From the top, you can see that there is the relation of the tonsil with the soft palate hanging in the middle. Below, you can see the dorsum of the tongue here. Please draw it. Okay, it's all very easy. Just keep drawing. Now, there is a condensation of connective tissue just lateral to the tonsil, which is indicating presence of a laterally present capsule. This capsule goes and gets attached to the dorsum of the tongue on both the sides, anchoring the tonsil in place. This anchoring ligament is called as the suspensory ligament of tonsil. Okay. So with this, we complete a bit of the immediate anatomy of the tonsil. Now, what are the structures laterally situated to the tonsil, or what is a tonsillar bed? Let's begin that. Just lateral to the tonsil, you will find a lot of loose areolar tissue. Okay. Lateral to that, you find 3 layers. Okay. As you recall, pharynx has 3 layers: pharyngobasilar fascia, the muscle layer, and the buccopharyngeal membrane. So draw these 3 layers on both the sides: the pharyngobasilar fascia, the superior constrictor muscle, and the buccopharyngeal membrane. Kindly draw this on both the sides. Lateral to that, limiting the whole area, is the bony mandible, the ramus of mandible. Attached to the ramus of mandible, on the inside, is your favorite muscle of mastication. Which one? It's the medial muscle. So draw your ramus of mandible, draw your medial muscle. Now, let's draw some additional relations. Coming from inferiorly, giving arterial supply to your tonsil are 2 major arteries: ascending pharyngeal artery, facial artery. The ascending pharyngeal gives rise to posterior tonsillar artery. Facial gives rise to the inferior tonsillar artery. Thus, you are in the diagram itself understanding 2 arteries supplying the tonsil: posterior tonsillar and inferior tonsillar. If there is an artery, there has to be a venous drainage. So, draining this laterally and outwards is a paratonsillar vein that drains into the pterygoid venous plexus. Please add that to your diagram. Now, if there is arterial supply venous drainage, there has to be a nerve supply. Now try to remember what was the nerve supply posterior 1/3 of the tongue. You will recall it is the Glossopharyngeal nerve, which also gives a twig to the tonsil. So nerve supply is done. In the lateral corner here, you will find 4 muscles, 3 of which come from the styloid. Do you recall what are the muscles coming from the styloid process? Styloglossal, stylopharyngeal, stylohyoid. Okay, so draw those. Stylohyoid is always accompanied by its favorite friend. Which one? Posterior belly of digastric. So add that. In this single diagram, you are now able to see all the structures that are around the tonsil forming the tonsillar bed. Right. So the diagrams we studied showed us that the anterior border of palatine tonsil is formed by palatoglossal fold. Posterior border is covered by the palatopharyngeal fold. The upper end abuts the soft palate. The lower end is related to the dorsum of the tongue. Then we also saw when we drew this diagram that its medial surface shows presence of such pits which lead to small crypts, tonsillar pits, tonsillar crypts. And then on the side it gives rise to one deep cleft which is called intratonsillar cleft, which is a remnant of something embryologically. Please find out and put the answer in the comment section. So these are your palatine tonsils. We also saw how it's covered laterally by the capsule. There is loose areolar tissue and there is a beyond that pharyngobasilar fascia, superior constrictor and buccopharyngeal fascia. Understand that your tonsils are laterally bound by the mandibles. Okay, so if you were to go deep in this direction, you would reach the tonsils. So therefore, most laterally it will be related to the mandible, covered on the outside by the masseter and on the inside by the medial pterygoid muscle. Inferiorly, your palatine tonsil is related to 4 muscles. 3 of them are very stylish. What does that mean, stylish? Styloglossal, stylopharyngeal, stylohyoid. Stylohyoid always goes with its best friend. Who is the best friend? Posterior belly of digastric. So these are the 4 muscles you would find on the side. Okay. Also, of course, you will find the arterial supply, venous drainage and the nerve supply. So this diagram gives it all. Okay. Please practice it a couple of times. This is much better than my entire lecture, frankly. If you know this, you don't need me at all. Right. So let's discuss arterial supply of palatine tonsil. Remember, again, upper end, lower end, anterior, posterior. That's how we remember blood supply. So anteriorly, it gets its blood supply from the lingual arteries. Okay, just understand. This is the maxillary artery branch of external carotid, ascending pharyngeal, facial and lingual. These are the branches supplying the palatine tonsil. Branches of the lingual artery come and supply tonsil anteriorly. Branches of ascending pharyngeal come and supply tonsil posteriorly. Branches from greater palatine come and supply the tonsil from superiorly, and the branch from facial artery supplies it inferiorly. This branch is especially important and is called as the palatine artery of tonsil, principal artery of tonsil. Okay, so what is it called? Principal artery of tonsil. You must be wondering why call something like this? This is especially important because it must be properly ligated when you're doing tonsillectomy. So this artery is an important artery that must be especially looked for. So this is arterial supply. What about venous drainage? If you saw in your diagram, there were paratonsillar veins draining into the pharyngeal venous plexus. Now these are surprisingly relevant, students. A damage to the paratonsillar vein can lead to a lot of hemorrhage. And how do we prevent this? See, when there is bleeding, there is clot formation. Normally, you would allow the clot to be there. But in case of tonsillectomy, usually you go and remove the clot to see if there is oozing from the paratonsillar veins. Okay, there is another situation where we do this, that's in postpartum hemorrhage from the uterus. Here too you have to remove the clot to check if there is a postpartum hemorrhage happening. Okay, so this is asked in the exams quite often, so just remember this. That's the arterial supply venous drainage. Okay, lymphatic. There is if you remember when you went to the doctor and you said, I've got a cold and throat-ache. And then the doctor went palpating like this and then he said, Idhar dukhta? Does it pain here? And then you said, okay. Why? Because he was trying to palpate your Jugulodigastric lymph nodes which are present in the gap between the anterior border of sternocleidomastoid, common facial vein, and the posterior belly of digastric. This spot contains a lymph node which we call as the lymph node of tonsil. Right. What about the nerve supply? You saw that from below, Glossopharyngeal was supplying the tongue and giving a branch to palatine tonsil. But it also gets nerve supply from greater and lesser palatine nerves. Developmentally, palatine tonsil comes from the endodermal pouches. Ventral part of the second endodermal pouch develops into palatine tonsil. Now we come to a question. It's in the oral cavity. Why is it? Who holds it in place? It would be so easy to swallow them, the two palatine tonsils. Actually, they are held in place by suspensory ligaments which hold on to it. Stalks of blood vessels also hold it in place. And the palatoglossus in the front and palatopharyngeus behind just grasp it. So that's why palatine tonsils stay there. Okay, so before we talk about applied anatomy, just relax. Maybe have a sip of coffee, maybe drink some water, and then we'll go to applied anatomy. Okay? Never stress and never push yourself unnecessarily. There's no point in it. So I have been introducing the applied anatomy to you throughout the lecture, but I'll still put it up together over here so that if you're using this as a note, then you'll be able to get your matter in one place. So inflammation of tonsil is called tonsillitis. Suppose you want to remove tonsil, what is the surgery called? Tonsillectomy. If you're doing tonsillectomy and maybe you make a mistake, what kind of mistakes can you make? Complications of tonsillectomy, right? So you can damage paratonsillar vein, it can keep on oozing, causing hemorrhage as discussed earlier. You could not ligate the inferior tonsillar artery properly, again leading to hemorrhage. You can damage the glossopharyngeal nerve. What will your patient say? Suppose glossopharyngeal is damaged. Patient will say, Doctor, I have lost my sense of taste. I'm feeling that I'm not able to taste my food well. Glossopharyngeal, taste supply to the posterior 1/3 of tongue, isn't it? Right. You can sometimes have a patient complaining of earache when he has an inflamed tonsil, again because of common nerve supply of glossopharyngeal nerve. Infected tonsil can become a focus of infection. The very lymphoid tissue itself can become a focus of infection. And suppuration of paratonsillar area is called as Quincy. These are some of the applied anatomies that are expected from an undergraduate student. We come back to the same thing. Take a screenshot. We discussed introduction. I have a habit. I always say introduce the topic to yourself. So then we talked about shape, situation. We discussed features. We learned arterial supply, venous drainage, lymphatic drainage. We did all this with the help of two simple diagrams. Then we discussed nerve supply. We mentioned development and finally applied anatomy. I hope all this helps you to solve the exam question of palatine tonsil, which can come in this manner. Okay? SAQs as well as LAQs. Okay? These are some of the MCQs that I want you to solve. Remember, these MCQs and more are also freely available on my website. Please go there and practice MCQ solving. So remember, students, draw to understand and visualize, draw to revise, draw to recall. Okay? That's always been my mantra. I always say, draw to remember. Don't keep on mugging like a crazy person. Of course, you're all brilliant people, but I don't think I am. I need to draw and understand, and then when I understand, it stays in my brain forever. Okay? So, know your strengths. I have a visual memory. If you have then you should be drawing and studying. Okay, students, it was a pleasure taking this class. I'll see you across the screen in some other video. Thank you. Bye.